In Hamilton, the daily case count hit a record high over the weekend. More long-term care residents are testing positive, and at least 3 more people have died, bringing the death toll to 85. Despite arranging an interview to ask questions of Hamilton Public Health, we were told this today. Given that officials from Public Health have no new information to share today, they are kindly going to decline this afternoon's weekly interview. For the latest on COVID cases in Hamilton, we'll send it over to Dale Manucdoc, who is live downtown tonight. Dale.
Nicole, Hamilton is reporting 61 new infections today. That's after 3 straight record-setting days of positive cases. However, the new infections do thrust the city into uncharted territory. For the first time, there are over 500 active cases here in Hamilton. Outbreaks at long-term care or retirement homes account for 9 of Hamilton's 19 active outbreaks. That includes Grace Villa, where the case numbers have increased 800% in just 2 days. They currently have 45 positive cases, 38 residents, and 7 staff. All of the residents were swabbed for COVID-19 on Wednesday, according to Mary Wraithby, CEO of APAN's Health Services, who operate the home. They're still waiting for more results.
I know that we get the positives first, so I would say if she swabbed 156 residents and we only have 38, we're waiting for a lot.
Last night, the home lost an 84-year-old woman to the virus, bringing Hamilton's COVID-19 death total to 85.
We are devastated, but we understand our responsibility to continue to care for the residents in our care, our staff, and our families.
Wraithby says staff shortages continues to be the biggest challenge for Grace Villa and the entire long-term care sector. Michael Hurley, president of Ontario Council of Hospital Unions for QP, says the shortage predates the pandemic.
Before the pandemic began, Ontario had the lowest level of staffing in long-term care and in hospitals of any province in the country.
While Premier Doug Ford's provincial budget announced earlier this month includes billions worth of support, including $1.75 billion for new long-term care beds and $461 million in a temporary wage increase for personal support workers, it doesn't increase the number of staff.
We should be looking at, immediately the hiring of 15 to 20,000 personal support workers just to pick up the slack within the system.
Back in July, just 2 days after Quebec announced they'd hire 10,000 full-time PSWs, they received nearly 70,000 applications. Hurley says another reason for the staff shortage is some are choosing to stay home.
They might have elderly parents, they might have young children, they might be looking after, kids with disabilities, and they're worried about bringing the virus home to them, so they're simply staying home.
The latest data Hurley received shows 9,307 Ontario healthcare workers have been infected, with 16 deaths. And as far as hospitalizations are concerned, there are 25 between Hamilton Health Sciences and St. Joe's, with one of those hospitalizations coming from Grace Villa. Now, CEO Mary Wraithby says that public health is still doing the contact tracing to determine why this outbreak is so significant. It's now the 3rd largest active outbreak in Hamilton. Nicole?